going to be the state of the county with more of a focus on health, whether it be mental health or like the opioid crisis, things like that are going on around our health systems. So that's why we invited a bunch of different people from different walks of life in the healthcare field. That way we can talk about like maybe some things like services that are offered that we aren't aware of, or some programs that are available, and just things like that, and how it's actually impacted our community, here in Powell County, and maybe even the greater region, like Eskimo, Wolf, and things like that, because we like to think of Powell County as our little own tiny world, but realistically, it bleeds out into other places, good, bad, otherwise, So I'll let you guys kind of organize that amongst yourselves. I know we got all kinds of different people here from different places and things like that, and everybody's got their own little topic. So there's no real big topic that you have to focus on. You kind of tell who you are, what you do in your field, things you guys have to offer, and stuff like that. So I'll just open the floor to whoever wants to speak. Okay. We got someone who's like, are you saying you can go sit, you can present, you can hand things out? It doesn't matter. I'm really like,
Oh, sorry. Yeah, I probably gotta put it back here if I'm gonna get any kind of sound.
Powell County is number 4 in the state for fatalities and overdoses. We currently have, and that's per capita, so that's per 100,000. Currently, this is a big report.
We're number 1.
Yeah.
We're number 1 and
There you go. Estima's number 1 and Lee is number 2. Redwood's number 3 and Floyd is number 5. In 2023, we had 16 overdose deaths, and the way that they do that is through the medical examiner's office and the coroners, so they report that to the state, and that's through toxicology. So I think that's kind of where we're supposed to start, although we just start with that. So there are several people in this room who are all kind of working together to help fight that. There's already measures that have been done before, and I will say I work closely with Estill County, and that's one of the best counties that, honestly, they have a big task force, and everybody in that community is just absolutely wonderful. So we even asked them to come and speak at a couple of things that we've done. So recently, we have been working on a quick response team. So that is a crisis intervention team that will go with. It's in the very infant stages. We are working out the logistics of that. We're working on the MOUs, which we hope to soon. And then It will go out, we'll talk amongst ourselves who can go, because, you know, that's why we have a big group. It's because not everybody can go, on this at all times. So we did at least 3 to 4, and then we'll go out, we'll talk to them, just see how they're doing, mostly. If they want a treatment, we're going to set that up to get them into the treatment facility. We'll also be able to give them bags, and inside of the bag they will have resources in the community, treatment resources. They will have Narcan that is available. We'll also, if they're not home, we'll talk to the family member if they want us to. If a family member even calls and wants us to come and talk to them, we're going to go out and talk to them. We hope, our goal, I think, is to kind of grow this to where we'll be able to talk to youth, you know, say the school wants us to come out and talk about prevention. You know, QRTC will be able to serve there be enough of us that we can pull those resources to go out and talk to the youth at school. Or if a parent calls, we're going to go talk to them. We also want to be able to start providing, I think we've kind of discussed this a little bit, but we're taking slow steps to doing the initial and kind of grow from there. Maybe the grief, you know, like grief resources. So if someone loses a family member, we go contact the family member and give them the information they need. So it is something that we've been noticing, is if there is overdoses, there might not be a lot of funding for a funeral or any like that. So we've been trying to, we've had a little bit of discussion on that. So I'm trying to think. We've done a lot lately.
Are you from the health plan?
No, I'm from Kentucky, Rio, where I live. Of course, I live here, but we work on a lot of grants. So we have a lot of state and person grants.
What does Rio stand for?
It is Rural Healthcare Information Organization. It's a $10 grant. So in healthcare, we have acronyms for everything. So that's one of the things that we've been trying to do. Okay. And then I could so the grants, it's like a few of the grants that we've had. This last grant that we were able to get funding because it was something that we heard a lot in the communities. So we were able to work in Estill, Powell, Bath, Menifee, and Morgan. Yes. And Montgomery. It's like there's 6 of them. And we developed a community resource guide mobile app. So you can scan QR code and then it'll have all kinds of resources. I can show you later if you want me to. I've got it on my phone. All you have to do is scan this. Also, get kind of into the mental health as well. We are mental health first aid instructors, so we can do it adult and mental health first aid classes, which is about in person. It's about a 6-hour class, and it'll teach you, like, say that you notice. We're going to use an example for you. Like one of their friends notices that, you know, their friend is a little withdrawn, and what to do, things like that, and how to react to it as an adult, what you would do if the child was thinking that was the case. And so then it's also what to do if you encounter someone and your friend, you know, so you want to assess the situation, do a program for use allergy. It's assessments and give advice, encourage, and then encourage the same. So that's a 3-year certificate
I'll talk a little bit about being on the front lines of the epidemic we're facing, and also what we're doing as a court to address this situation. Being an EMT, a lot of days, half my calls are drug related. You know, I've been there at the worst times of his life. I've been there when his son has passed away, and mother comes up and says, "I just thought you were on Narcan, and you come back to life like he always does." You know, Narcan doesn't always work. You've been there and had to face that fact, and see the family and the turmoil it causes afterwards. But it's just it's not just the illegal drugs. Like, we've gone to elderly people that's got their medicine mixed up and have overdosed. You know, we've had children get into the gummies and overdose, not die, overdose. So, it's not just the illegal drugs out there. It's illegal drugs plus it's being used incorrectly. The county, the state of Kentucky sued the pharmaceutical companies that made OxyContin and got a huge settlement. And Powell County got $1.2 million that's going to be paid out over a 15 or 18-year time period. 18-year time period. And so we've got a committee together to go through and spend that money. It's Leandra, Stacy, myself, Neil, Megan Mason, schools. We got like representatives from all the different branches of the government or the county. We've got a lot of different input. But what we're using that money for, the first part of the money we spend on what we call a pilot program. That's where we're going to take our jail inmates who've been convicted of drug crimes and who are eligible. It's like a home incarceration program where they will be put on home incarceration. We have a company that's going to be monitoring them, and they will give these people a job skills. They will give them housing. Part of the problem is when they get out of jail, they don't have anywhere to go. They go right back in the same situation, and the process just repeats itself over and over again. So we're giving them the tools where they don't have to go back to that same situation. Another benefit of that is that this program is going to be self-sustaining. It's the same program that Clark County uses right now. We're going to have 20 inmates to start this program off with. And over a 1-year time period, it's going to save the county over $200,000. And that's, from now on. So the county's going to save a lot of money because we don't have to house those 20 inmates in our jail. They'll be monitored by the pilot program. And so we don't have to pay the cost of the inmate. So that's one good thing about that. Right now, looking at the studies, I can't say this word, reciprocity, getting out of jail and going right back into jail. Yeah, that's it. I couldn't say that word. Anyway, about 80% of their inmates right now are not going back to jail, so it's a successful program. And so we're getting into that program. We're spending $40,000 on an incinerator. Right now, we have no way of destroying the illegal drugs in the county. We used to have drug boxes in the courthouse. I think one here at the Municipal Building. About 2 years ago, we got taken down. Part of the problem is people were putting their expired aspirin, expired Tylenol, and the police officer here could not keep up with emptying them out. And then you had to kind of sort through them. We had a police officer that was exposed to fentanyl and went down immediately and had to be Narcan and almost lost his life because of that. So you can't just destroy these illegal drugs any way you want to. There has to be a certain procedure, and we've got to have an incinerator for that. So we are going to get incinerators back, and we're going to put the drug boxes back up at the courthouse and back here so we can start disposing of illegal drugs. I'll let Stacey talk more about this. We're going to be doing a Too Good for Drugs program at schools. This is going to replace the DATA program that most of you are probably familiar with. Too Good for Drugs is an evidence-based program, and I'll let you talk about that because you know more about that. We also have a large advertising budget. We're going to be putting out promotional items and getting the word out about QRT and doing some of this stuff. Now, here's the catch. These pharmaceutical companies had to pay out billions of dollars to the state of Kentucky. So, when the state of Kentucky gives Powell County this money, they've got lawyers, the pharmaceutical companies do, that's going to go through every receipt, everything we spend it on. If one penny is spent for something other than opioid abatement money or drug, to help the drug overdose situation, then the county will be forced to pay that back. So right now, across the state of Kentucky, there's a big, huge pool of money, and everybody's afraid to spend it. CACO, which is the Kentucky Association of Counties, right now, they will not tell us, you can spend it on this, you can spend it on this. There's nothing that says yes or no. And so we're having to kind of use our own judgment about what we spend it on. And so that's why we're kind of hesitant about spending this money right now. But we do have a budget in place now. We proposed it at the fiscal court meeting last month, and everything got approved. So now we're just having to cross the T's and dot the I's to spend this money. So that's what's going on with the county budget.
So I'm Stacy Craig, I'm the director at the health department, so I'll pick up where he left off on the Too Good for Drugs. So we knew we wanted something in prevention. That's obviously something that's lacking. And DARE, that we're all familiar with, they ended up saying it wasn't evidence-based and it wasn't providing the results that we needed. So Too Good for Drugs is actually proven and evidence-based. It has curriculum for K through 12, so there's different lessons based on the age groups. The problem for us has been staff because we're tiny. We can only do so much with 10 people. So this money will allow us to hire a coordinator because that's a lot of kids, a lot of classrooms. If you really want to do it right and reach all these levels of age-appropriate lessons. So we want to hire a coordinator that can take care of teaching those classes and really getting the message out to hit it from the prevention side. Also, it's just at the health department, so of course we see them when they're already addicted, and a big program that we have is a syringe exchange program. So that's controversial, a lot of people have opinions about that, and I can understand that. I mean, I kind of did too before I was the director, or I really understood what was going on with it. But I've learned a lot over the years and seen how it's harm reduction, so it's just kind of like, wearing seat belts, helmets. We give out condoms because there's things that you can put in place to reduce the harm if an activity is going on. So we know these people are in need of help, they use drugs, so it's a practice of meeting them where they are to try to reach them, give them clean syringes in hopes that they bring the used ones back and don't throw them out the window or down at the city park. So we get them back in, we give them clean ones. That's good for the community. It's also good for that person because that's somebody's dad, son, sister, mother, and they most of the time are just in this addiction and they don't really know what else to do. They want out, but that's a place that we can meet them. So I do have this that I'll kind of pass around. This is you're getting the first look for the Board of Health because I'm giving it to them next month, but I always do the numbers on our syringe exchange. So this tells how many visits we had, how many participants. But you'll see it's not just about, here's your free needles, like free candy. I mean, we do so much. We try anyway for that person while they're there. So you'll see that treatment is offered. We had 137 referrals to treatment with Spark peer support counselors. So that's 137. And you don't know would they have gone to treatment had they not had that relationship with the staff that work there. So we try to meet them where they are. They say they're 7 times more likely to seek treatment if they participate in the syringe exchange program. We give them naloxone, which is Narcan, so 442 doses of that were given, and that could have prevented, they come back and they tell us, yes, I used it on someone, and we give it to them again. So that's being used. 1,110 fentanyl test strips, so they can test their supply, whatever they use, to see if it has fentanyl in it. That prevents drug overdoses too. We also test for hepatitis C and HIV, so that way we can give them some disease treatment, kind of keep an eye on that. So those are some of our numbers. You'll notice that over the last year, we are down about 50% in our visits to the syringe exchange. And I don't really know why that is, I would like to say that these people got treatment, and that's why. But we don't really know, are they in jail? Are they using a different drug where they don't need the syringe anymore? Don't really know the answer to that, but we just keep on keeping on. Just keep doing what we're doing and providing services. We also, things that not on this paper would be, we had a grant for winter clothing items, hats, gloves, socks. We try to give them snacks, hygiene kits. We really try to just provide that support and relationships where when they're ready, it might not be the first visit, it might not be the first year, but they can say to somebody that they know and trust us, it doesn't judge them, that I might be ready to go to treatment now, so. Then on the back, just a couple other little things. We had a grant last year that helped us provide, and we still are continuing, we kind of paid Spark to provide us peer supports, because like I said, our staff is small, so that's a way for us to kind of work together so that we have another face that, you know how it is. I remember I used to teach years ago, I was a facilitator for a Stop Smoking program at the health department, and most of the time the first thing they asked me is if I ever smoked, and I haven't, so I lost credibility right off the bat. So that's where the peer supports come in. They've been there, they've quit, they know how to help these people. And then we also did a podcast for actually the last 4 years, because we, during COVID, we really couldn't get together, so we did a lot of conversations through interviews and on this podcast. And it's been really interesting to see the different perspectives and how the drug epidemic has hit different people. And we were able to put the stories together in a book, so this was just released today. This compiles some of the pictures. There's a QR code in here that takes people to the podcast so they can listen. We hope they listen to episodes, but that's just there's a But Nate Brooks was our young, innovative mind on that had that idea. But let me show you one just to this one. A daughter's journey, and she lost her mom, so what these kids struggle with. She talks about at 8 years old, she's getting her 1-year-old sister up and changing her diaper, things like that. So it's been amazing, this project. And I do have a few of these, if anybody wants one afterwards, but just trying to get the message out, reduce the stigma, just meet people where they are and provide resources. And then of course we've been helping with the opiate abatement committee. Like he said, they're not really saying, here's your list of things you can do. So we're looking for other research and other ideas so that we can provide rationale for why we want to do these things and try to hit prevention all the way through recovery. So.
Just we could say that we have a lot to talk about this. We have meetings before we discuss. Trying to figure out, okay, so I think that it's being taken very serious. It's not just.
Do you have referrals to get in the program, or are you proactive in this educating people and saying this is available and waiting for people, or how?
For the syringe exchange?
Well, just to get in the program, or to get, any of the assistance that you're talking about.
It's mainly open. We try to advertise it's open Thursdays from 12 to 4, and it's at our back door, so they just come around.
Walk in.
Yep, every Thursday. So.
And then eventually, so like with QRT, we will have track cards with the QR code on it, where they started the health for instance, as someone that they can, if we're even a business, we can take on as long as that person is okay, they can know that they can do a referral. So they can send that QR code and do a referral, and we'll try to get them into any type of treatment, see them when they're at, so it's for a couple. So.
One thing I'll mention is that on the Too Good for Drugs programs, our local county PBC board is also putting money towards that. Alcohol beverage. Anyone who is, they're also part of that too. So they can send that tax money out for liquor sales in the county, and they are putting back into the education for the kids. I don't know if this is really related or not, but we did find out today that we're building a new ambulance service building in Stanton, and it is going to have a 70-year baby policy. That's something. Yeah, it's completely good. You want?
Well, thanks about that.
Yeah, that's
We just got one in my school, I think within a day.
Yeah. Right. That's a pretty big deal. That's actually.
No, just use this. We just have a few minutes. I work at last. We have to go to work. I go to break time. You know, you
sign up to take a chance on something that has a 50-50 chance of killing you? Is it that, I don't
They're just like chemists, they keep on much stronger from the, drugs to be like, in the book, I think Junior Wise, that's kind of corner talks about, when fentanyl first came out, they would give you like 1 or 2 doses of Narcan, and it would take care of it. He said now, they're up to 12 and 15, not everything, whatever, to overcome the fentanyl because it's so powerful now. It's just, I'm going to get glad and I'm going to see how much worse they can make it is.
So it produces a euphoria similar to heroin or whatever, and that's why I guess it extends it so much further.
We were actually looking at a body scan from the jail, and because, we got a great program for letting inmates out programs, but, the convicts are kind of sneaky in this, they find ways, and so we were looking at a body scan, that's not been proven at all, but we're hoping the body scan get the jail out, so we don't get drugs inside the jail. The ways they sneak drugs into the jail just blow you away. How sneaky, how clever, and plus the fentanyl, just a pencil, into a pencil, they put on something that small, and
Just opening an envelope and you get overdosed. That's scary.
Right.
I'm sorry. So my name is Tracy Sizemore. I'm a nurse practitioner with Strong Healthcare. I don't know if everybody knows where we're located. We're at the Knox Community Center. We have been in Powell County since March of 2021. We are a federally qualified health center, which basically means we're non-profit and we get government funding to help with resources in a underserved community. We offer primary care services, behavioral health services, school-based health. We have programs for transportation, so if a person can't get to the clinic, then someone from Sterling Health will go get them and bring them to the clinic. I think they deliver meals too.
Yeah, it's kind of full-time prescribers in Powell County and Mount Sterling, Montgomery County, they deliver medications, but we have limited drivers here, so it's kind of case by case.
So we do have an MD on site, and then we have 4 mid-level providers, PA nurse practitioners. One of the nurse practitioners is in school-based health. So if the child is sick at school and the parent can't bring them to the clinic, then she goes to the school to visit the child, and she updates the parent on what's going on. Our MD does do math, since you were talking about math. I have 1 math person. I think I started with 5, but they tripled off. But I've had her for 3 years. She's doing very well. We do work with the behavioral health specialists, so we have 3 LCSWs, 2 in the clinic, and 1 in school-based health. What's an LCSW? They are licensed certified social workers, so they offer therapy services, help with anxiety, grief counseling, trauma counseling. They also offer IOP services for our MAC patients. We do have a mental health nurse practitioner who comes 1 day a week for patients who can't be managed by their PCP. So he will see those. We do have a MAC clinic in Mount Sterling. It's Crossroads. I think it's fairly new. But sometimes that can be burdensome for patients to go to. We do offer Hep C treatment. Dr. Holbrook and myself do chronic Hep C treatment as long as they're going to be compensated, which means they don't have liver cirrhosis. If that's the case, then they have to go to a specialist. Let's see. Oh, we do have community health workers, so they work on finding resources the community health worker that we have in Powell County works with Connect, so she can help people who don't have insurance get set up on Medicaid. She is not with Medicare, so she can't help them, but she can give you resources to find that. We do have a sliding scale program for people who cannot afford insurance. So that's based on income, and they may pay as low as $15 for a visit, doesn't matter what it is. And then the pharmacy has a sliding scale program associated with that. So I'm gonna let Laura talk about that.
I'm Laura, I'm the pharmacist at Sterling Health. So we have 4 pharmacies with Sterling Health. It's in Bath, Carlisle, Stanley, Mount Sterling. And we do a lot of sliding scale. So if you qualify with Sterling Health Care, regardless of your insurance situation, we can do the medication at our cost plus $4. The big thing about that is because we're a federally qualified health center, we get the drugs at a vastly discounted rate. So some of the branded medications for us cost 4 cents. So the patient would pay $4 and 4 cents. And that's helped tremendously with a lot of our patients. We do have, like Maverick, we give for patients with the Hep C, work closely with the MAT and the Hep C people in Bartley, to get that covered for patients. And we can deliver depending on the patient case, what's going on with them. Everything's the sliding scale. So, thank you.
We can go from Mercy Health.
Start.
Virginia.
I am Kathy Withers. You probably have saw me maybe a little bit with some of the chamber meetings and things like that. I have been in a dual role for a while now, but recently transitioned into the foundation president. So I've moved more into the charitable arm of the Mercy Health Ministry. So you still will see me a lot around, but now my focus is a little bit different. It's really more geared towards looking at that support piece of it for the different communities that we service, and our service area is Estill, Powell, and Owsley. That's what we call, but actually we're kind of up in Worth County a little bit now. We trickle over a little bit into Waco, with some people coming back that way, but I love it. We're always looking at different campaigns and different ways and needs of each of the communities that we work with. And of course, we've got 3 clinics in those areas. Owsley is one that we don't have, but a lot of the Owsley population trickles to the Lee County market, so we still are able to help them. But with my role, we're really just working in conjunction with our community health director that we have on those external projects and coming up on the money girl. So coming up with a way in order to support what we are going from a grant standpoint, we are focusing on a special project that there's a certain area that they want the foundation to pick up, and we do that. And we have a really huge focus right now, which is focused on liver disease. We were talking about liver disease, and our campaign this year has been on liver disease and implementing a fiber scan equipment that will identify those individuals that could possibly be getting liver disease and or beginning those stages, and it just helps us to be more of that early detection piece of it versus after it's too late and we're not able to do anything. We have a couple of providers that are very, very passionate about that because some of them, was seeing some of the Hep C patients, the individuals that, do have drug abuse, but the other flip side of that is all of those individuals who don't have that drug abuse background, and so, and that number is very, very large. So that's kind of my focus now, and then I get to work with a bunch of wonderful people that have very defined roles within the ministry, and each of those in different areas. Maywood starts rolling out and talking about the acronyms, I said, break it down to acronyms. And what's even funnier is if I'm out on a visit with somebody and they start talking about something and they lose me halfway and I take really good notes and I come back and say, this is what they said. I think they said this, and then she'll giggle a little bit and say, oh, I think this is what they did. But we all are still learning, and I've been with the ministry for, I think, almost 12 years now. And Trina, and yeah, about the same thing. So, and I'll let you, because you're over all of us.
So, like she said, I'm Trina Stalker. I'm the resident of the Irvine Market, which does include the hospital. We are a 5-star CMS rated critical access hospital in Municipal County. We have 3 clinics, which the clinic here in Powell County is Dr. Julie Hennon, Sandy McCoy, nurse practitioner, Felicia Estes, all hometown girls that are at our clinic there. You also see Bobby Allen sometimes, who is from Irvine County, that comes in and visits that clinic. When we talk about the urban market, we also have 2 outreach labs where we have lab services in different communities, as well as all of our community outreach. The hospital sees anywhere from about 25,000 to 30,000 patients in the urban market a year. That's between our clinics and the hospitals, as well as we have a fully functioning, we're the first level for a trauma center here in the state of Kentucky. We are also accredited in chest pain. We also do stroke. We have a number of other issues. One of the great things about being part of the ministry is we do a lot of telehealth. So we have cardiology services, we have endocrinology services, we have pulmonary, we have orthopedics, podiatry, and a few other services that actually come into the hospital so the patients don't have to drive to Lexington. All of our cardiologists right now are based in Lexington, but by seeing them at the hospital, you save having to go into downtown Lexington and deal with Nicholasville traffic. You can see them at 60 Mercy Court when they're here. So people love that and can kind of get that. One of my passions is, Kathy said, I'm a nurse by background. I was actually the chief nurse executive until 2019 when I became the president, and I did a dual role of chief nurse executive and hospital president for about a year and a half. Not recommended to do both of those a national pandemic, but we now have a director of nursing that oversees our clinical arm of it, and it allows me to focus not just on the clinical oversight, but as well as all of the community. And we have really taken a focus from doing big community events, although we love the festivals and we're very engaged. For the Corn Festival, we sponsored all of the inflatables, and we will do things like that. We find that ourselves taking our community out into the community. So right now we're very involved in our Red Ribbon Weeks at our schools, working with all of the mental health and suicide training in our schools. We're doing a lot around that, as well as the grants. Right now we're sitting with about $6.5 million worth of operational grants. This lady here is in charge of all but 80,000 of them. We had to give a little bit of money to somebody else, so we went ahead and gave somebody else a little bit of it. But the whole idea with our grants is twofold. We all know that there's not a lot of money in healthcare, so it's not like I can have a dream and want to open a new service line and open it today. So we use a lot of grants to kickstart that service line to prove how valuable that is and how many patients we can impact. And then I go back to the powers that be. We are a multinational ministry. We have 5 hospitals in Ireland. We have hospitals all over the United States. So sometimes I have to remind them, and we love saying $1 in Irvine, Kentucky goes a lot farther than $1 in Toledo or $1 in Cincinnati, which are some of our larger markets. I just recently was in Pennsylvania visiting we were just talking in the car on the way here because we were Kathy was actually going to kill us. She's right. Because unfortunately, I had 5 o'clock meetings, so we could not leave right at 5:30 as we expected to leave, so we were trying to make up the time on the 82. But when we stopped and talked about it, you know, sometimes it's very frustrating to say we're still number one, even though we have all these great programs in place. But I was struck by Cameron Harden Duke as we saw the report, and he said, imagine where you all would be if you didn't have this stuff in place. You'd still be number one, but just imagine the numbers. And that kind of struck me as, that is scary, because think about everything we do and how many Narcans we give out, how many visits we have, and we're still number one, so where would we be if we weren't? So I'm going to turn it over to Penny and Nathan to talk about the numbers we would have in Esco County and some of the things that we're doing.
So hello, my name is Steph. I'm over in the Grants Department Hospital. There's a couple of statutes just to let you know, we did start our response in 2020. And although we have been numbered from the top 5 for 5 years, since 2017, we still have programs in place, and as you mentioned, we could be functioning far worse. One thing I do want to mention though is that although the fatality report says, for example, we get 10 last year, the reports are not exactly accurate. Death certificates is what is submitted, and that's how it's classified for overdoses. So, for example, if someone has a heart attack, passes away, it's classified as a heart attack. It does not get counted as an overdose. But our coroner has consistently read psychology, so we know that they say 10, he says we have 33 because he runs toxicology on suspected overdoses. So it is trended up for overdoses, but we're going to continue to fight that fight and plant those seeds. One thing I will mention about before I turn it over to maybe to talk about the program and bring back and her relationships with the sheriff and the mess, but we also do mental health and chaplain services. They're very involved in our response team. They involved make them plan out these visits because that part of it is valuable as well. But for mental health as well as the suicide prevention that we provide at schools, we have baby that we do in middle school and in high school because those programs continue to grow as well. We also did receive a award at the Kentucky Opioid Grant, which will focus on relationships with the jail and the county. That's where our people are transported to, is the county. Building those relationships, so when they are released, they are trying to put them into a path of recovery. Part of our overdose task force that Leanne mentioned is it's very active with community members in Esco County and other surrounding counties that come together and talk about overdoses and those deaths. So what we discovered earlier this year with those discussions of individuals in that group was that a lot of individuals that are when they're released from jail, they'll go back to using the same level of drug they did before they will die. So that this is a grant that we're going to focus on trying to catch them and put them into a path of recovery when they're released from jail. Also, we're looking at resources for those that part of our overdose fatality review team also look at resources for those that are the family members who have lost loved ones. That's something that we're working to build that support in the community. So I'll turn it over to Maywood. She has our response team relationships that you have.
Okay, Roxanne Sarah Maywood, and I did a PRT with Brad Chapman, Jericho, the behavioral health, and then Randall from our EMS. And we usually go around to different places do food bags, we do hygiene kits, we do clothing drives, different things like that. Let's see, what else? The
Tents and sleeping bags.
Oh, yeah, sleeping bags, yes, and tents. Let's see, what do that? Talk about the court program? All right, the court program is run by me and Jerica, and it's called the Journey Back program. And we just recently had 2 guys graduate, about 3 weeks ago. So, and they got into this program because they had some misdemeanor charges. But if they completed the program, they typically complete the program. If they did, that would be dropped off the charges. So we had 2 graduates. They're doing good. In the program, we had AA meetings. We had smart recovery meetings. We helped them find jobs through KCC. What else did we do?
Community projects.
Oh, yes, we did community projects. For the first community project that we did was Valentine's Day at the nursing home. We made cupcakes, we made cards, went around and gave each patient one, and we didn't have much anything.
Community.
We did the garden, we did up there at the animal shelter, we did the flower beds up there, and that's about it. 6 months. The program's 6 months.
So when they had their graduation, this was really wonderful to see. When they had their graduation, it invited the judge, the sheriff, the jailer, all of these guys that were involved in incarceration and getting them into this program. They came and they spoke and they talked about how proud they were, and it was just and that they were supportive of them and they'll continue to support them and how they hope they would continue to stay on this path of recovery. That was wonderful that they came to support.
They also share their story with the foundation group that does the newsletters. So here's the thing, all that kind of comes together, which is wonderful, and reaches out to other individuals about their experience. Maitland is heavily involved in it, but the 2 gentlemen, one more, a little bit more comfortable than the other, shared their walk under the program, and they were videotaped. It's very emotional, beautiful video, and then was just released when we got to see it, and it'll be out on foundation web pages, so it will touch other individuals. So that's one of the things with a lot of these different programs that we run into that we want to, is we have a success story, whether it's something we purchased and implemented, or whether it's a program like this. And we're very blessed to have a lot of those programs, but when you do have those successes, we try to share that out there so others can see that it can be done. And Maywood in this video was, she walked. So it was kind of like they were telling their story, and as they were, she would interject with a little bit of her history too. So it's a really touching story. But it was the 2 guys that just graduated. So I could brag on it. It was good. It was good.
I'm Melissa, the technical appeals, and today I was in the clinic. So what Sterling
I'll tell you that I'm still struggling with what to do with the mobile. Trina, what should I do with this mobile? Please tell me something. It's beautiful. It's, I mean, it's going to be great, but it is not serving enough people. That's what I'm talking about, but that's another story. But it is not serving enough people, and I'm still looking for that niche just to be very open with that. We need to figure out what we need to do next with that. We've been at the homeless coalitions, and they're not to devalue, but there is value in the two people that we see each day. But the level of care, we're putting a nurse on it, we're putting a provider on it, we're putting an intake person with it, they can refer to behavioral health, they can refer to case management, we'll have insurance if you're eligible. All of those things are coming together. I'm missing something, and you all know better than we do what it really ought to be. And we've done everything from being in the homeless coalition parking lot to being in the parking lot at Slade. We've done the Powell County Homeless Coalition. We did that actually today. So I'm open to that. I'm tempted to go back and park like we used to in Estill, just go park back at our building and put a provider there, a couple of days. I don't know. If you all know, please tell me. Because I want to, we want to do the best we can with that service. And the nice thing about it is provided for a person grant, it really does not have that many strings attached to it, which we all know is a rarity to have that because it's paying for our funds. But we want to do the right thing and the best thing with that. But a couple of things that stood out to me that I just wanted to mention is this county, both counties, I try to look up how I'm going to start this to look it up, but Bluegrass Reentry Council is something that might be a little bit outside of what you're thinking, but you may find lots of great information there. I'm certain Eston's part of it, and I think Powell's, but if you're not part of the Bluegrass Reentry Council, you're part of the one beside it. Do you know? We need to look that up. But they are back and active, but somebody has to take that lead. It used to be that their reentry coordinators could lead that. They can no longer do that. Big long story, doesn't matter. We took that, Fudos took that on. It's easy, it's mostly done by Zoom. But the things that you can learn from your inmates and your population that's back, go run one of those simulators here. Run a reentry simulator. It is so valuable to do and to figure out what chaos we all cause because of all the things that we ask them to do and fill out and complete and it's the wrong kind of social security card, so see you again in a month. We've got to figure out how to stop doing those kinds of things. But I would highly recommend a reentry simulator or even a poverty simulator is a really great resource to be. I also was at Bluegrass Ads Human Service Committee, and every county has a representative on there if they're eligible, and it is judge appointed, and how do you not have an appointment right now? And but for example, this past one was about 3 and how it's managed after an overdose, and that was exactly what the whole conversation was about. It's not a huge time. They use Zoom. It only meets quarterly. You review the CURPS, which takes no time. People are already got the money by the time we review CURPS. So it's not a big breach, but you hear from a lot of other counties are doing the region. And it's not so bad kind of focus that it's not that. So how you might check on that and see who your representative is and tell them to reach out to me. I've done it for years. And it comes in things. And the other thing I was going to mention is a little bit outside of health, but we do it out of the clinic. We have become expungement experts. Not at all. It is not an expert. No. I don't know what the word is, but we can help you get expungements done. So Apple Red is very generous about doing those kinds of things. They're a great partner for us. But if you walk into Apple Red and you are in Madison County and your other charges in Montgomery County, they can only deal with Madison County. It's the craziest thing. So we just walked in Montgomery County. I should have brought the report, y'all. I don't even know, 12 pages long. She's lived in Powell County her whole life, and she hasn't had a charge in 12 years. can we just lock them? They're all misdemeanors or class Ds. Can we get this expunged? Yes, we can. It's life changing for her. It changes where she can live, and it gives like it takes a year. I mean, it's worth the investment to do this. And I know this is not exactly health related, but I feel like it's very helpful. Yes. So
It is because sometimes if you don't have things expunged, you have a harder time getting some of the insurance products. You get a harder time getting into some facility. I mean, there's so much attached to it. You can't qualify for Medicaid, but you also can't get a job because you have 12 pages of charges against you and nobody will hire you. So it does impact health. Plus it impacts their mental health too, because they're trying to do better. If they have this 12-page report that basically says you're a bad person, so you can't do better. And that's what's terrible.
yeah, that's But I can teach anybody in this room to do it because it's not hard. I have no law background. I'm a business major. So it's not hard to do. It's just filling in the paperwork. So I just throw that out there as it's another opportunity. The fees are almost always waived. I bet we haven't paid over $400 in 3 years. Almost all of it. So just in trying to think about other things that we haven't already talked about. It's good that you can have this many people interested in for anything.
And I'm just going to say too, I think our privileged to work with most of the home care people here. And the last year, 2 years, especially in California, we're all thinking together, we're trying to break the cycle, really, and just work with the because it takes a community, honestly. And also, sometimes I have to like, Brian told me to get the values first. But I have we also have a situation table, where we meet every Wednesday at the Spark office, and we do the agencies that come together. What that does is, there could be a situation where a community member could fall through the cracks. So we come together as, you know, come together, talk about it, and then we try to kind of partner with that. We go out and meet them, connecting the resources. Sometimes it'll take weeks. Sometimes we can get it done in a week. And sometimes we can take 3 months. But it's, you know, we've seen a lot. We've noticed that there is some barriers here. There's some gaps that we need to work with for elderly as well. And connecting them to the resources that they need to be connected to.
everybody's doing. I mean, these are things that most of us in the business, I was telling you the other day, in the business section, we don't know about the drug overdoses, the mental health that needs to be done, a lot about the homeless, unless, you know, somebody really sits down and says, stop, listen to me, you know.
What was it, emergency, Wednesday?
It's impressive what you all are doing.
I think that brand is a big thing now. That wife was doing a lot of stuff.
Yeah.
But I know that, now we got that, get that word out to the people.
Yeah, it seems like that was, and we covered the situation that it was about to follow up. Definitely that's more right. Still, we didn't have to keep that straight every day. Yeah, absolutely.
It was suggested to move that action with the local and look at least.
Look, we're going to come.
Yeah, I want.
Okay, I have a few more.
Okay.
I was
Okay,
thinking about it.
that is wonderful.
Isn't it?
I didn't get to read a lot of it, but it was great seeing some of the people that, you know, that's sitting there busy on the front page, you know, all of that. I look forward to actually reading some. We didn't have enough time today to show it to me in the office. I loved it. It was really great.
The podcast is awesome, but we just wanted something, like, we want to go into banks, doctor's offices, just somebody picking up.
Yeah. Well, if you're a visual, I'm a very visual person, so I like to see it. I'll talk to you, but I want to see it. And that just brings it all into perspective.
We have several that we're getting out, so we bought a lot for the grant, so we're not paying for anything, but we'll try to spread them around, and if it's where we've got the word name, we'll try to find another grant, because it's already done. Yeah,
I'm also grateful for the because I think that it's going to make some really famous things on the listening platforms. I think we know all this about it, but so it was a really expedition and it reached almost 49,000 people estimated, and then on the listening platforms we were almost at 1,000 on the listening platforms, and it has been listened to at least once in every state, and it's also been listened to in several other countries, Canada, as well as Mexico, and those are like recurring listens. So I think that's pretty.
and just, you know, most of these people are in the room today to get their copy.
Does anybody else have anything else to add, or you have to say something?
Well,
You've been quiet.
well, not usually, but I'm really honored to be here and to learn so much about what's going on in Powell and Estill County. Estill County's my county for the senator as well. 18 counties for him, and I'm just extremely impressed with the teamwork and the ideals and programs and just everything. I want to keep up the good work.
side of life that we really don't provide exposure to.
Yeah, and kind of related to what Judge said earlier, you know, and I don't have to probably speak for why, is being a business owner and, you know, having employees and things like that, like, you don't realize sometimes that they may be struggling with some things that you're not really aware of, but then maybe you become aware of, and it's like, well, how do I help them? You know, because I don't know, it's not something I went through personally or anything like that, so who do I reach out to for resources? So it's kind of, it's neat to hear all these things, but, you know, it's kind of disheartening when you hear that we're number 1 or number 4 for something that's not what you want to be number 1 and number 4 for, you know. But that, to me, just signifies a huge opportunity that we can do all these things and have all these programs in place and really turn that around and then be almost like a model for another county that's now facing the issue that we just came out of. They say, hey, look, these guys over here they were bad or however they want to, you know, categorize us. But then we did these things, or they put these programs together, and this is what they got out of what they got out of it. So it's just kind of cool. So I guess everybody keep doing it.
For us, we have to kind of walk, you know, we're walking a very thin line. So we're working with the kids, and we're doing these STEAM activities with them. And in February, we did the National Art Month. The American Heart Association gave us all kinds of things. We had coloring pages that we did with them. We had art models. We explained to them about things that are good for your heart, things that are not good for your heart. And we had papers there that they could take home to their parents for stop smoking and things like that. So, but I feel like the Too Good for Drugs, these are awesome, but like to me, I think for us, for Discovery Zone, I think we need to leave those things at the schools. Are you with me? But if you all, I mean, if you could think of anything that could tie to science, technology, engineering, art, and math, and not be too, I won't say preachy, because that's not really, I mean, I'm blown away by what you guys are doing. It's just, God bless all of you. Yes. Please, I'm very supportive of you all. Yes. But, so if you could think of something that's kind of sciencey, that we could do, I mean, we'd be willing to do that.
And that would be really good because you all are such a good influence on the children in the beginning.
So do you have any inflatable lungs and do like the baking education and everything?
We could do that, so is there, so we like to kind of tie to a theme. So like that month of February, that was easy because that was the National Heart Month, right?
Remember,
we also did Valentine's Day, so they also got to do. But,
We were talking a little bit about some information that we had given before and how we could utilize that with one different event or how would we, you know, factor that into there. So,
I mean, if there's something like they could hypothesize how long it's going to take them to fill a balloon, and they're going into the balloon or something like that, and then we talk about whether their lungs weren't working.
You have them breathe through a straw, and then you have them breathe through a coffee stir, and say breathing through the straw is like if you've been smoking this long, breathing through a coffee stir is if you've been smoking this long.
I wonder,
We absolutely, that is something we do constantly when we have the teddy bear fair, which all of the Powell County kids come to the teddy bear fair. But when we have the teddy bear fair, that's something we use, and we usually use like big straws like to get Sonic and the big and say, this is, you know, so you're starting to smoke, you're breathing normally, then we give you the straw, and then we give you the little straw, and now we're going to give you a coffee stir, good luck with that. That's what it's called.
What is your teddy bear fair?
Usually in the last part of March or April, and then all of Estill, Powell, Lee County, homeschoolers in Madison County, one
we just turned to grow as well. With August. I too have learned a lot last year. I've learned how little sleep I can live on. So, my conscience. No, it's, we really are blessed, and we're very thankful. The level of growth and building we've had this 1 year has been really surpassed any expectation we've had. So now we're at that stage, we're trying to support that growth, get a bigger team, get more equipment and things. We've actually had, I just registered an LLC for our sister company, which is I call it Irvine. It's just an audio video game. We're going to start trying to put out more ways of absorbing content, just an audio video game that. And so that's how this happened. I really appreciate everybody coming out.
Thank you. Does anyone else have any